purpose is to revise yesterday's Zoom lecture with YouTube media, because more and more medium I want to introduce so that subject becomes clear. We spoke in detail about tentorum cerebelli yesterday. Yes, this is tentorum cerebelli. Now our today's purpose is to discuss falx cerebelli. Falx cerebri. Just look at this word, falx, F-A-L-X, falx cerebri. Now, what are its attachments? Its attachments is crista galli. You can clearly see, focus the crista galli. And of course, posteriorly, it extends to internal occipital protuberance. You can easily see the internal occipital protuberance. So, what you have seen, yes, look at my finger, that is crista galli, and you have seen internal occipital protuberance. Now we'll focus on its theory aspect. What exactly you have to write? Of course, you have to write attachment. Approximately some marks are allotted to this, 2 or 3. So attachments. So attachments from crista galli to internal occipital protuberance. Its superior margin extends towards internal occipital protuberance. Just remember this sentence. Its superior margin extends towards internal occipital protuberance. Now, what are its relations? Most important, that is superior margin is related to SSS, that is superior sagittal sinus. I am repeating, superior margin related to superior sagittal sinus, while inferior margin related to inferior sagittal sinus. So, superior sagittal sinus and inferior sagittal sinus. So, superior margin is related to superior sagittal sinus. I am a bit slow. Superior margin is related to superior sagittal sinus, while inferior margin is related to inferior sagittal sinus. Never forget its relation with corpus callosum. Some students don't write its relation with corpus callosum. So approximately after attachment, there are some marks allotted to relations. So attachment relation. So what are relations in brief? 3-finger technique, superior sagittal sinus, inferior sagittal sinus, and most important, yes, that is corpus callosum. Superior sagittal sinus, inferior sagittal sinus, and corpus callosum. I am repeating and a bit slow. Superior sagittal sinus, inferior sagittal sinus, and corpus callosum. I am repeating again. Superior sagittal sinus, inferior sagittal sinus, and corpus callosum. I shall repeat attachment, that is crista galli and internal occipital protuberance. Look the direction. How it is. This is crescent shaped fold of durameter. Some books have given it sickle shaped fold of durameter. I hope you remember the spellings of crescent and sickle. So I don't want to repeat those spellings. Now what about its applied anatomy? That is meningioma. So that is applied anatomy is a frequent tumor which is found in falx cerebri, that is called meningioma. Now, what happens in meningioma? There are seizures. And most importantly, there is dementia. Remember, what is dementia? I want students to read. This is the purpose of this type of communications, especially Zoom, YouTube. I want students to read. I want students to read about dementia. Dementia में क्या होता है? And after dementia, yes, there is a difficulty in talking. So it is not which symptoms you write, the way you write the symptom. First priority is dementia. देखो पहले क्या होता है, dementia होता है, और dementia के बाद there is difficulty in talking. Just I'm a bit slow. First, there is dementia, then there is difficulty of speech, not talking. I think you should use proper words. So, dementia, so after dementia, there is difficulty of speech. So, D for dementia, D for difficulty of speech. And yes, for distinction, you must add one more thing in meningioma. because we are studying meninges. So meningioma. So what happens in meningioma? There is a loss of bladder control. I am repeating a bit slow. So what happens in meningioma? There is a loss of bladder control. There is a loss of bladder control. So superior sagittal sinus, inferior sagittal sinus, just revision. Attachment, relations and meningioma. Attachment, crista galli, internal occipital protuberance, relation superior sagittal sinus, inferior sagittal sinus, and never forget corpus callosum relation. And of course, we are discussing meningioma, that is seizures, dementia, difficulty in speech, and sometimes there is loss of bladder control. So I'll repeat: seizures, dementia, difficulty in speech, and sometimes there is loss of bladder control. Thank you so much.